There are so many drugs for congestive heart failure. How do we know which ones to prescribe? As internal medicine physicians, we are primarily focused on your mortality and your morbidity. So we want to help you live as long as possible. That's what mortality refers to. But that wouldn't be meaningful unless your day-to-day functioning was improved. That refers to morbidity. Morbidity is basically your day-to-day consequences of living with the disease, your day-to-day suffering, the symptoms that you have. In this video, I'm going to list the classes of medications that we and cardiologists prescribe to help improve your mortality. We'll start off with ACE inhibitors, which are also known as angiotensin-converting enzyme inhibitors. And the examples include lisinopril, enalapril, there's quite a few of them, captopril, that help improve your mortality. They, along with beta blockers, will help improve your mortality starting from 15 days up to 3 weeks. Now, examples of beta blockers include metoprolol succinate, not the tartrate, but the succinate version. And then we have carvedilol and bisoprolol. The second class of medicines that help improve mortality in CHF are your mineralocorticoid antagonists. Think of spironolactone and eplerenone, and they have been shown to help improve mortality at 28 days. The third class of medicines include the SGLT2, also known as sodium glucose cotransporter 2 inhibitors. Examples of these include dapagliflozin, also known as Farxiga, and then empagliflozin, known as Jardiance. Now, many diabetics are on these medications, but in the research trials, they found that patients who are on those medicines actually had an improvement in their mortality compared to those who weren't. And then finally, we're going to refer to angiotensin receptor neprilysin inhibitors. They're also known as ARNIs. Entresto is a main one, and these have shown to help improve mortality. Giving a patient even half of the target dose has shown an improvement in mortality. You are likely to be started on one or more of these drugs already if you have a diagnosis of congestive heart failure. I hope this brief outline of the improvements on your mortality is helpful to you. If you have any questions, please post them below. Until next time.